we provide technical assistance, financing, and training to nonprofit childcare centers that are planning facility improvement projects. Before we get started, I just wanted to go over a few logistics. We will be recording this webinar, and we'll share the slides and recording to all participants after. We will also be sending an evaluation survey so that we can make any improvements to our second webinar, which will happen on November 5th. So your comments will be really helpful to us. And all attendees are on mute right now. The chat function is disabled because we will be using the Q&A function instead. But please use the Q&A function at the bottom of your screen at the time that you're ready to submit a question. But we do encourage you to hold off on submitting your questions until all of the presenters have presented, simply because they may answer the question that you have. So if that works. And then we will have time again for a live Q&A portion at the end of the session. Okay, next slide, please. So we will hear from Karen Shirley and Mike Lindstrom from the architectural firm StudioMLA, which will review some of the design modifications that you might consider. And then we will hear from Peter Dussault from the engineering firm WB Engineers. And Peter will focus on best practices for HVAC systems and ventilation. As I mentioned, we'll have a Q&A session after both firms have presented. And we know that many of you have been thinking about and working on issues for many months in regards to your facilities and improving them to make them healthier for the children and educators. And you might be far along in those solutions to the space that works best for your program. We encourage you to feel free to submit through the Q&A during the Q&A session any solutions that you came up with that would be helpful to other providers, and we can share that information. But before we get started, we would love to get a sense of the folks that are on the webinar this afternoon. So we are launching a poll that will appear on the screen, and there it is. So please tell us which type of program you represent, whether you're a center-based nonprofit, a center-based for-profit, a home-based or family childcare program, or any other advocacy, policy, or nonprofit organization. Or if you don't fit any of those categories, please check other. And this will just be helpful to the presenters as they begin talking and giving you information. So just a couple of seconds, we'll close that poll and then we'll see the results. Great. So 72% are center-based nonprofits, about 12% center-based for-profits, another 12% home-based, 8% other advocacy, policy, or nonprofit, and then 8% other. Great. Thank you. Thank you. I appreciate you doing that. Okay. Next slide, please. So, so this webinar series is being presented alongside a funding source called the Early Education and Out of School Time Capital Fund, which is EEOST is the acronym that many of you have heard of. This year, EEC and the Children's Investment Fund have modified the program to target small facility improvements with grants between $100,000 and $250,000. There are 3 categories for this special round of funding, and you'll see them on this slide here. The first is you can apply for funding if you are planning to make capital improvements that are necessary to comply with the pandemic health and safety measures, any emergency repairs that impact the health and safety of the folks in the building, the children and educators. That could be a roof replacement or an upgrade to the electrical system. And then the third category are physical environment modifications that address accessibility or other improvements to support inclusion of children and adults with special needs. That could be a mobility ramp or an upgrade to an elevator. So those are just some examples of things. In terms of eligibility, this funding is for center-based EEC licensed ECE and OST programs that serve at least 50% low-income families. The grant range again is between $100,000 and $250,000. And I should say, you know, very important that all the application materials will be posted on the Combis, which is the state's procurement site. That information is not there yet. We're hoping that will be there shortly within the next day or so. But we will make sure that everyone on this call gets that information, but you will also get, it will be posted through EEC and through us as well. So you will certainly get the materials once that's posted, and we can share the information, session date, and all of that information. Okay. So the modifications that we will highlight in this webinar are eligible costs that the EEOST Capital Fund could potentially cover this funding round, right? So it's with that lens that we offer this training and this information. However, if you are not eligible to apply for EEOST because you're not a center-based program serving at least 50% low-income families, we still think you're in the right place. We know that this webinar will be helpful, and we hope it will be helpful as you try to create the healthiest environment for the children that you serve. So now I will turn it over to Karen and Mike from StudioMLA to introduce themselves and begin their presentation. Thanks.
Thank you, Teresa, and thanks for inviting us to present today. So StudioMLA Architects is an architecture and landscape architecture firm in Brookline. And one of our main focus areas is early education environments, indoors and outdoors. So, you know, in the same way that you have been affected over the last 6 months, we've been working with literally dozens of programs, trying to help them think through the physical aspects of reopening and opening safely. And Karen, who is a designer and project manager in our office, has really taken the lead on that. So what she's going to do today is walk us through a series of slides that talk about what we've seen as sort of the key issues that come up that can be, you know, and how those can be addressed in some cases on a temporary basis, in some cases on a more permanent basis. I think there's a range of solutions. And obviously, we're learning more every day, but we're really happy to be able to talk to you today. And if there's questions at the end, we'll be happy to answer them. Take it away, Karen.
Next slide, please. So a couple of the things that, as Mike said, we're learning as we go, but there's some things that we do know, and we have some really great questions for you. So one of the key concepts for healthy environments is, 1 is fresh air, 2, good hygiene, and 3, ample space. And we're going to take a look at each of these and talk about how maybe you can think about incorporating these into your facility. Next slide. So fresh air is the first one. It's the single most important factor in maintaining a healthy indoor environment. It's clean and uncontaminated air. You want to try to look at increasing the percentage of fresh air. You want to look at natural ventilation. If you have windows, operable windows, that means opening them up and bringing in the natural. But if you don't have natural windows and natural ventilation, you have to look at what you do have, and that's your existing air HVAC system and filtration. And Peter will talk a little bit about that later. But one of the biggest benefits during this time period is having operable windows and being able to open those up and let the fresh air in. As you think about that as childcare facilities and preschools that are in the New England area, you're going to say, oh, great. Well, that's great for, you know, April through October maybe, but as we get into these winter months, what are we going to do? And there are things that you're going to need to think about. You know, you're preparing your parents and the children that they may need not only their outdoor warm winter coats, but they may need some extra sweatshirts and gloves and things for inside. But also as much access to the outdoors as possible. So getting them outside, even when it's cold, even when it's snowing, as much as possible. So fresh air next. Oh, sorry, go back. Then healthy environments, good hygiene. We already know that we need to wash our hands, we need to sanitize everything, and we need to screen people as they come in make sure that we're keeping the occupants of the building safe. Next. So that may mean that you think about your entry into your facility. A lot of centers have been trying to screen people before they actually come in to the center, having health checkpoints outside, using maybe screening stations like the one on the left, or just a table and checking on temperatures, or checking the questionnaire of, have you been exposed to anybody, anything, before they come in. Do you feel okay? So there's ways to do that, but not everybody can do that, especially in New England throughout the winter. Next slide. So you may have to think about, what can I do inside of my center, in my reception area, lobby, as parents come in, to protect my staff. And so thinking about plexiglass barriers for protecting the staff and parents from any exposure, and keeping the extra staff or extra parents and extra visitors out of the protected zone. Next. So we don't have all the answers, but we have a lot of good questions. And maybe these questions will help you think through what you can do. Can you expand your lobby? If you have a tight space, is there any way to make it bigger so that you can be talking to one parent and another parent can be socially distant enough before at check-in times and things like that? Can you use other doors? One center realized that having everybody come in through one checkpoint at the front of the center was not going to be, they weren't going to be able to kind of follow the CDC guidelines and make that happen there, but they had doors to the playground. So each classroom had a door to the playground. So they looked at putting their entry point through the classrooms from outside and doing a check-in station and hand washing before the children came in to the classroom doors. But so look at doing screening outside. What if you do screening outside? What will you do during the winter months? Is there's something that you can do to make this happen better during the cold months?
I would just say, I'm just going to interrupt here and say that one of the reasons we're very excited about the grant program is we feel like the amounts are enough that obviously the suggestions that you're going to see in the webinar today, not all of them are going to make sense for everyone. But I think every center should be able to go through and from this sort of menu of what we're going to talk about and what Peter's going to talk about, find the things that would have the greatest impact and, put together a couple of those or 3 of those, or see, what combination of ideas makes sense. And how could that help your center both short term, coping with reopening and with the current pandemic and the regulations around that, but also long term to improve the space in the center.
So like, let's say you have a tiny lobby reception area, but you have room to expand that and maybe build or create a vestibule for screening and hand washing before they even come in to your lobby area. Is that a possibility? Is there a container or secured space to have deliveries from vendors left outside of the lobby for contactless delivery? My neighbor is 70 years old, and she, instead of having deliveries left on her doorstep, she has a Rubbermaid container, and she goes out once a day with her gloves and her mask, and she takes the boxes out, leaves the boxes that have been touched by other people out, wipes off whatever has been delivered, and takes it in with her sanitizing wipes. So thinking about, is there a way to kind of decrease the amount of things that come into the center, setting up for deliveries, things like that. If parents are not coming into the space, is there technology that you need at the door for them to reach someone within the center? If you always have a receptionist at the reception desk, that's great. But if they get up to go assist with a classroom or something, you need to have a way to reach people in other classrooms, a doorbell, a speaker system, a phone, something at the front door to be able to get contact others in the classroom or at the front desk near the entry. Next slide. So access to hand washing. You want to be able to, as children come into the center, be able to get them to a hand washing thing as soon as possible, whether that's at the entry or whether it's they go all the way to the classroom and they wash their hands as soon as they come into the classroom door. Just thinking about where do you need to add hand washing. You'll also want to make sure that, you know, sinks are convenient to your food prep and diapering and toilets, so that hand sanitizing is happening immediately after each of those activities. And also outdoor hand washing. There is even though outside is less is better for fresh air and things like that, but they're going to come in and they're going to bring in whatever they've touched outside. So trying to have an opportunity to wash their hands either before they come in the door or as soon as they come in the door from outside. Next. You can think of hand washing in two different ways and adding sinks in two different ways. There are the plumbed center sinks, which is what we're most used to, where it's affixed to the wall and doesn't move. But there are also the opportunity to look at portable sinks, and maybe, you know, you for this time period need a portable sink somewhere near the front of the center in order to get some hand washing done before they come into the center. So think creatively of what we can do to make this work for us. Next. If you're going to be replacing or adding sinks, you may want to think about hands-free features. They have touchless faucets, touchless soap dispensers, paper towel dispensers, and you can even have occupancy fixtures on your lighting so that when you walk into the room, the lights just automatically come on, so you're not constantly touching the light switch on all day. Easy to sanitize surfaces. What is ideal? You want something that's cleanable with bleach and other approved cleaners for the classrooms. You want resilient flooring as much as possible, like VCT, which is what's shown in the picture, or linoleum vinyl tile. Even hardwood is much easier to clean than carpet. Carpet kind of just traps everything. Smooth, non-porous solid surfaces should be used as much as possible for countertops and other wet areas. Next.
I would just say, Karen, this is, you know, things like this are also just great examples of improvements that you could make to the center that have a real impact now in terms of the health and kind of COVID measures that need to be taken, but also are just going to improve the center long term in terms of ease of cleanability and durability and all of those things.
Yeah. Yeah. And so the other thing that you may want to consider is antimicrobial surfaces. There are coatings that are now available for flooring, door hardware, faucets, window shades, other types of things that kind of prevent the transmission of those germs. Copper is also a natural antimicrobial surface that can kill microorganisms before, you know, they have a chance to grow. So for example, if you have a cabinet and you want handles on those cabinet doors, you might want to consider having copper handles or copper knobs as opposed to a different kind of knob. Some laminates, a lot of cabinetry now is made out of a plastic laminate instead of wood. Those laminates and cabinets and work surfaces can also have antimicrobial protection so that they can protect against spread and stand up to regular cleaning. If you're hitting it several times a day with bleach, you want something that can withstand that kind of cleaning product. Next. As you're looking at your facilities and thinking about how to continually protect your staff and children, you might think about adding laundry facility or sanitizing facilities, the capability to wash staff smocks and other linens every day or every week as things are used can be very helpful to helping maintain that clean environment. Also consider if a commercial sanitizer is needed for toys and dishes. There are several of those on the market, and it's kind of like a dishwasher, except for it gets hotter and sanitizes your toys and dishes to the point that nothing can survive as far as germs. Next. Providing ample space. You want to try to provide as much ample space in the classroom, space between children and groups within the classroom, allowing for a large variety of activities or duplicate activities. If you only have one set of blocks, you may want to divide your blocks in half and have 2 different block stations in order for, 2 children to be playing at the blocks, but maybe not necessarily sharing the same space. Larger volume of air as much as possible. Ample space for circulation. So when you have a narrow hallway, looking at, is there any way to make this work better for the children and staff? Ample outdoor space and easy access to the outdoors, because you want them going out as much as possible. Next. So room configuration, key questions. How much square footage do you have per child? Is there additional space in your building you could utilize for storage or for expansion? How could the circulation of your hallways and auxiliary spaces be modified? So this is an example of how a facility, kind of spaced the arrows on the floor and put drive aisles in, so that you were making sure the children were staying on their side as they passed each other in the hallway. Next. So when you look at room configuration, this is a room that has ample space. And if you look at there's one kind of area over on the right, and then next is another area at the back, and then finally another area here. And you can have several different areas within this space and people be fairly separated. So thinking about your space and how do you create these zones, one way is just by having them far enough apart. Another way to consider it is to provide clear divider panels to classrooms. Different facilities have these panels that you can create these zones within the room, which helps kind of keep that separation of 1 or 2 children in each zone to help implement the physical distancing. Next. As you think about things that you need for your classrooms, one idea is individual desks for eating and activities where they're sitting down. You could try to create that distance with these individual chairs with individual trays on it. Or if you look at your existing tables and chairs and how do I kind of create these zones within the existing furniture that we already have, one way is by creating these plexiglass dividers for the group tables. Next, outdoor space. When you think about your outdoor space, is there any way to provide tent or shade for the rain and for the sunny days outside, so that maybe some classrooms could be out here during reading time or different activities, story time outside? How much can you create out there to allow those things to happen? Next. Providing kind of a covered outdoor play space so that you can be out there when there's just a little bit of rain patter or maybe a nice rain flow. Next. Trying to make sure that you have separate play spaces by age group so that you can provide that social distancing. Next. So some key questions. Again, we don't know all the answers, but we do know some of the right questions to ask. And so as you think about your space, here again are some questions that may help you think about what you need to do. How can you maximize the time outdoors? What would best facilitate that? Do you need tents? Do you need tables for snack time? Do you need more play equipment? Are there repairs or upgrades to your play space that you've been meaning to make, and now this is the time that makes sense to make those, because that they help you get to your final goal, and it's a good idea for the design of your future in that space. How might you modify your outdoor time during the winter to make it work better for you and allow you more time outdoors? So these are some of the questions that will hopefully trigger ideas as you go through and evaluate your space and think about this opportunity that's being provided to have some funding. We hope that, you know, if you have questions, you'll reach out to us. We're happy to help you think through things, but these are just kind of, a lot of you are in early childcare, so you know about story starters. Well, these are kind of the story starters, the questions that get you thinking on how you can make your space better during this time and for the future of your facility. Mike, did you have anything else you wanted to add?
I think that's it, Karen. I think you covered most everything. I'm sure there'll be questions at the end, but we want to leave plenty of time for Peter as well. So,
okay, thanks. Next.
Thanks, Karen and Michael. There's a lot of great information there. Again, my name is Peter Dussault, and I'm with WB Engineers. What I hope to try to do today is simplify something that I think there's a lot of discussion in the marketplace, and there's a lot of confusion around. So hopefully I want to take something that's complicated and make it really, really simple. So if we go to the next slide, please. Next one, please. All right, so basically what I want to let everyone know is that the recommendations in the discussion I'm going to have today are all based on ASHRAE, which is the American Society of Heating, Refrigeration, and Air Conditioning Engineers, CDC, and the Harvard School of Public Health. There's a lot of great information out there. I've gone through most of it, and what I'm hoping to do is simplify it and bring very simple concepts forward that can be implemented easily. Next, please. Thank you. So Karen touched upon it. One of the biggest things we can do is increase fresh air. There's MERV 13 up there. What that means is it's filters. So the two basic things that we're looking to do to combat COVID-19 inside of buildings is, one, bring in as much fresh air as possible, and two, filter the air as best we can. So if you think about it, if you were standing on the top of a hill and the air was blowing, the wind was blowing, and you were there with someone and you were upstream of them, there's almost no chance of, if you're upstream of them, of COVID-19 infecting you, because all the air is moving past them. So if you had a constant flow of fresh air, constantly changing clean air, breathing clean air, that's the entire premise of what we're talking about. So we want to bring in as much outdoor air, fresh air as we can. And then what we want to do is, inside the space, filter it as best we can. So that's what I'm going to run through real quick today. Next, please. As an engineer, we always like to think of things, and we have sort of decision making matrices. And this is basically what we're looking at. So here's high level how I see different spaces. One, do you have an HVAC system serving the space? If you do, we go down one method of solving the COVID-19 problem. If you don't, we look at it a different method. Next slide, please. So again, I'm going to probably say it at least a couple more times. Fresh air, fresh air, fresh air. If you're outside, it's the safest place to be. So what does that mean? It means if you have windows, open them. If you have an air conditioning system, try to bring in additional fresh air. And what I mean by air conditioning system, a system that's sort of not window units, but more complicated systems, maybe something's on the roof, maybe something in an attic area, or something that's in a closet where there's fresh air brought into them. So you want to make sure that we're bringing in as much fresh air as physically possible. What I mean by that is there's limitations to one, user comfort. So your occupants have to be comfortable. And two, the systems themselves have limitations. So those are some of the things that we need to be thinking about. Next slide, please. Okay, I am an engineer, so I love to nerd out a little bit. And I think to talk real quick about filters. What's important about this slide, there's all these MERV, everything else. What I think is important is when we look at this slide, we see the little chart here on the right and it says MERV 8. That's what typical HVAC systems have the ability to remove virus-sized particles. What the CDC and ASHRAE's come back and said is instead of using a MERV 8 filter, use a MERV 13. If you use a MERV 13 filter, instead of only capturing 11% of the virus-sized particles, you're going to now be capturing 46%, which is a 400 times increase of the amount of particles you're going to be removing from the airstream. Okay, so you can go up higher than that and look at MERV 15 and higher. The difficulty is when you get above a MERV 13, the HVAC systems really weren't designed and don't have the ability to use that higher filter rating. Now, what's very interesting, if you look down on the bottom right-hand corner, you see HEPA. I'm going to refer back to some portable HEPA filters later on, but if you look at the efficiency of that filter, okay, it's really, really good. It's getting almost all of the virus-sized particles out of your airstream, which is really, really important. It's something that we want to do. Okay, next slide, please. So there we go, HEPA filters, portable HEPA filters. These things are typically, if you're familiar with like a dehumidifier that you may put into your basement, something like that, those are about that size. I'll have some information on cost next. The way you size them, it's dependent upon the size of the room, area, volume, okay? They're relatively inexpensive, meaning you're spending in the hundreds of dollars. You need typically one per room, and we'll talk about when these are applicable. But one of the things that you should really be careful about is the noise level on these. Some of them can be rather loud, and that can be a problem if you're trying to speak to the children or just the communication. So you want to be sensitive to the fact that you want to keep them under 15 dBA. One of the other things that we see in the marketplace with the portable HEPA filters is there's a lot of add-ons. You'll see things like bipolar ionization, hydrogen peroxide, UV lights. My feeling on this is when you go to the add-ons or accessories, they typically double or triple the cost of these filters. If you're going to be removing 99 point something % of the virus from the airstream, why would you then want to kill it? It's going to be in the filters. So the way that I would recommend, what I would recommend is if you have a choice between adding accessories to your portable, to the portable HEPA filters versus buying another HEPA filter, I would buy two, because what will happen is you'll clean more air faster. And again, it's fine. We're gonna filter all that virus-sized particle out of the air. If it's in the filter and away from people, why do I need to kill it? So the recommendations that we have, Harvard School of Public Health, is go with straight portable HEPA filters and skip the accessories. Okay, next, please. So here's some basic information. Again, I pulled this from Harvard's Public School of Health. They put lots of info in it. This is assuming a certain height, ceiling, And it basically gives you a sense of where the costing is. Again, these are relatively inexpensive to some of the other solutions that we see in the marketplace in combating COVID-19. But this is a real simple way, and it's a really good way to clean the air inside your space. Okay, next one, please. So electronic air cleaners, there's a whole bunch of information in the marketplace. And some of the ones that we see a lot of are photocatalytic oxidation, ionization air purification, ultraviolet germicidal irradiation or UV light. These are great solutions and they kill the virus really well. The issue with these is a couple things. One, they're expensive. Two, the first two on the list here, they're relatively new technology, and there's no studies that indicate if there could be long-term adverse health effects to the occupants of the space. So basically, our recommendation is until those studies are available, we wouldn't recommend them. We've tested them. They do work, but again, we're not willing to make the recommendation to install those technologies until we can get some long-term data on health effects. The UV light or the ultraviolet germicidal irradiation, it's been around for an awfully long time. The medical industry has been using it for 50 years. It works well, but again, in most cases, this would probably be a very difficult installation. So next, please. All right, so what I want to talk a little bit about is what I touched on earlier, is sort of that decision-making process, matrix. So as an engineer, what I first do is I walk in and I look at the space. And in this case, I would look at this space and I would say, is there an HVAC system here? And the answer is yes. I look at the ceiling and I see two diffusers. So the first thing we would want to do is look at that system. And we would go look at it and we would make the recommendation to bring in more fresh air as much as the system can tolerate. And secondly, increase the filters that are already within that system. Again, you typically have a MERV 8. You want to try to get to MERV 13. MERV 13 is the recommendation of the CDC, ASHRAE. That's where we want to go. If the answer is you can't increase the fresh air, or there is no fresh air, even though you have an HVAC system, or you cannot replace the filters, then the simple solution is a portable HEPA filter. Okay. Next one, please. So here's another example. And again, I'm going to go through my decision process. I look, I don't see any diffusers. This leads me to believe that there's not an HVAC system serving the space. You may have baseboard heat. That doesn't work because it doesn't provide airflow. In this case, I would recommend deploying a portable HEPA filter. Next one, please. So in this case, again, I walk in, I look, I identify windows. And then what I also identify is that one of the windows has a window air conditioning unit. Unfortunately, a window air conditioning unit doesn't meet the requirements of a typical HVAC system. I can't have that bring in lots of fresh air. I can't filter the air. Now, during September, October, maybe May, beginning of June, I could open the windows and I could get lots of airflow into that space, and that would meet the requirement. But once we get to a point where you can't keep those windows open, I can't flood the space with fresh air, I can't put a filter into that air conditioning unit to try to filter the air, then again, what the solution would be is a portable HEPA filter. or 2, depending upon the size of the room. Okay, so if you have an HVAC system, these are the questions that you want to ask. Can I increase the amount of fresh air to my space? What type of filters do I have on my system? Can I get MERV 13? If the answer to either one of those questions is no, then the solution is portable HEPA filters. If the answer is yes, then you want to basically replace those filters, bring in more fresh air, and then you don't necessarily need to have the portable HEPA filter. I will add though, if there are places of high occupancy, or what I mean by that, are there places that there's some concern? If you have the ability to add more HEPA filters, it's always a good thing. They are good. Okay, next. So one of the other things that I just wanted to mention is that you could have an engineer or you could have your contractor do ventilation studies in your space. They go through, they look, and they basically do the evaluation that I had just done. The one place where it gets tricky is when you start to change HVAC systems. You really want to make sure that someone who's qualified is looking at those systems to make sure that you don't damage them. If you put the wrong type of filter in a wrong system, you could cause some issues. So you want to make sure whoever is doing this has a good understanding of how the system works, and make sure that whatever they do, there'll be no adverse effects. Thank you.
Great, and thank you, Peter and Mike and Karen. I'm Kira Taj. I'm with Children's Investment Fund, and I'll help moderate the Q&A portion. So we do studio some questions, and I encourage all the attendees to ask more if you have them. I think the first one we will ask of StudioMLA, do antimicrobial material services retain those properties long-term? Do they hold up, or is there sort of a time frame to those?
So that's a really great question, Kira. That depends on the surface. And I think it's also relatively, so there's materials that are sort of naturally antimicrobial, as Karen had mentioned, like copper and brass, and those things definitely retain those characteristics over time. There's other engineered, I would say, produced antimicrobial surfaces. And I think there's less really research and evidence on those. So the thing to do if you're considering using one of these materials, and I think there's a real kind of cost benefit analysis, because in general, you're probably paying more money for these. So I would weigh how durable the materials are, period. And then you have to do a little bit of research with whoever's producing it, and do a little poking around, I think, in terms of the research on long-term effects of those materials. Great.
And then a question for Peter. What do you think of mobile CASPR units, CASPR?
Well, I'm so glad you asked Michael the first question, so I had time to Google it. And I apologize because we're trying to keep up with as many products as possible, but the industry is flooded with them. When I read through it, what I see real quickly is it's using hydrogen peroxide to kill virus. The problem, and I don't want to use the word problem, you need to be careful with some of these technologies, because hydrogen peroxide is an oxidizer. And what that means is, if you have someone who may have some sensitivities, upper respiratory, things of that nature, this could be an irritant to them. I'm not saying that it's going to make people sick, but it could be an irritant. I know my son growing up had childhood asthma, and if he went to a friend's home and went to a musty basement, he would get irritated. So to give you a sense of what could happen, I'm quite sure that this technology works really, really well. But I would be very cautious with these newer electronic air cleaning technologies, because again, long-term health has not been, any long-term health effects has not been identified. There's no long-term studies.
I would just add that some of the technologies have been sort of already been used in hospitals and medical settings for a long time. Things like the HEPA filters are really proven technology. And I would assume that within the next couple of years, things would filter out so that we'd have a much better understanding of what's really works and what's cost effective, et cetera.
Yeah, Michael, I would agree with that. And I want to make sure I don't take too much time. What has happened is the market has been completely flooded with solutions that solve the COVID-19 problem. We recommend that you find things that are tried and true. I'd be more than happy, and I probably won't have enough time on this call, but if me and my firm can be a resource, if people are asking what the right thing to do is and looking at different products, we'd be more than happy to help out. We try to go back to what's been tried and true. And at the beginning, I talked about ASHRAE. If you can find a product that's been endorsed by ASHRAE, which is the American Society of Heating, Refrigeration, and Air Conditioning Engineers, it's a bunch of PhDs and engineers who get together to set the industry standards. That's where you want to be. What you'll find is a lot of these products don't have ASHRAE or CDC backing.
So, and thanks for that. And Peter, in a minute, there are a lot of questions about sort of like the rate of air exchange. So I'll ask you about that. But Mike and Karen, there's a question about sinks. And under what condition is it, would you recommend a portable versus a plumbed sink, just generally?
I think if it's any kind of situation where you may not want to sink there forever, right now, COVID will eventually, hopefully, be settled. That doesn't mean that there won't be other viruses that come along. But if there's right now a need to have a hand washing sink in your vestibule before people come into your center, the portable sink allows you that opportunity to do that. There are some challenges with it. You have to take out the portable thing of water every day and dump it, and you have to refill it, so there's challenges to having a portable. It's always more convenient or better to have a pumped sink if you can, but there are some places where you can't. So
the flip side, Karen, the flip side of that too is if you have a classroom that doesn't have a child sink, for example, now is a great time to add one permanently, because it's always going to improve hygiene and the utility and the functionality of the classroom. So it's obviously plumbing a permanent sink is a more expensive proposition, but it's a good, it's a good investment long-term if it's in the place where you eventually would like to have a sink, need a sink.
Thank you. So Peter, there are several questions about how many air changes per hour is adequate. Would you recommend running portable filters throughout the entire day when you're in operation or overnight? What's what sort of time constraints might you?
So the number of air changes you want to get is, I think 4 is the low end, 6 is optimal. The more, the better. So if you think about it, if you open the windows and air is constantly moving through a room, that's almost continuous air changes, which is great. So I would say 4 to 6 is where you want to try to be. And that's falls in lines with the recommendations over at the Harvard School of Public Health. I would recommend running those filters all the time, because if there's virus-sized particles in the room, if you think about it, you're only going to change the quantity of air within that space 4 to 6 times. Let it run. They're small. I saw there was also another question here about, are they dangerous? There is a small fan in it, but it's about as dangerous as what, again, your humidifier, if you're familiar with something like that, there's a small fan that moves air through it. Fingers really can't get inside of it. Could toys and stuff end up inside of it? I can't that's a whole different issue because kids get toys and stuff and everything and break things. So I think that there's always the opportunity of them doing that, but I don't believe that children could be hurt themselves with them.
I would say we actually have a few portable HEPA filters in our office now, and they're very self-contained. We don't have kids here, but I think they would be pretty easy to monitor and pretty hard for kids to pull apart. And if they did, they're not super dangerous. So
Great. And Peter, there are a couple of questions about how do you safely change or clean portable air filters, and then the sort of the air scrubbers, how do you clean them? Are they useful?
What I would say is that if you can get them outside of the building, because now you are in fresh air. Now, if you think about it, if you have this filter and it's filtered out all the virus-sized particles and there's virus there, you definitely don't want to open it up inside because now all that virus is back inside. So we recommend that you mask up, glove up. I know that folks don't necessarily have true PPE where they're in Tyvek suits, but mask up, glove up, and when you're done, make sure that you practice very good hygiene because you've effectively just opened that filter up, and whatever is in there, if there is something in there, now could affect you. Did I hit all those questions, Kara?
I think so. And another one, who typically completes a ventilation study?
An engineer or there are some HVAC contractors have the ability to do it. The pricing is typically a few $1,000s, couple to a few $1,000s, depending upon the size of the facility.
Great. I think we have time for a couple more. We may have to ask, this is a question from Andrew, we may ask you to ask it. How can we utilize HRVs to help with existing mechanical systems and increasing fresh air intake? And if you could explain what HRVs are, Peter, if you know that, otherwise we can ask. So what we'll do in a minute is, Andrew, if I can ask you to ask your question live. But in the meantime, I'm not sure, Peter, if you covered opening windows and so someone said, I read in Germany is recommending opening doors and windows every 20 minutes. Have you heard anything like that? And is there a time duration for opening windows?
Open them all the time. If you can't, open them 20 minutes. If you want to open them as much as you can tolerate. So I guess the answer is, if you think about it, if it's on a windy day, maybe you don't need it quite as much. If it's a still day, maybe you need a little bit more. And I hate to do that. I mean, at the end of the day, I'm an engineer and it's like, it all depends. There's too many variables. But what I would say is, yes, always open the door, open the windows.
Great. So Andrew, if you're available, I think I allowed you to unmute yourself and you could ask, I think you had 2 questions. If you could choose one to ask live, let's try that.
Thank you. Can you hear me?
Yep.
Okay. In most of the buildings that we design, we're providing obviously new mechanical systems, but also providing HRVs or heat recovery ventilators, or ERVs, energy recovery ventilators, so that we don't have to rely on users or occupants to open windows to get fresh air. So these are units, I'm sure, Peter, you're familiar with them, that they're bringing in fresh air constantly and exhausting stale air constantly, and we can regulate how often they're used. And sometimes we tie them into the mechanical ductwork, other times they're entirely separate from the ductwork, but it allows us to not have to open up windows in December and January just to get the fresh air, because we're exchanging stale air with fresh air without losing all that heat. So how can we use HRVs in conjunction with either new or existing systems to make sure, and how do we determine whether they're operating 20 minutes out of an hour, or constantly to get the fresh air we need?
Sure, that was a great question. That's one of those really technical ones, so I get to dive into it. So first and foremost, I refer to them as ERV, so I apologize. So one, You got to be careful of the technology. If it's a way, and typically if you're looking at smaller ones, it's not a wheel. But if the airstreams are going to come in contact somehow, so for instance, if there's a wheel that spins and transfers that heat from the exhaust stream to the intake stream, you've now contaminated the fresh air. So if you have that type of system, ASHRAE does not recommend running it at all. If it's something where you don't have the exhaust stream and the intake, in the fresh airstream coming in contact, then what we would recommend is running them all the time, because again, what that is allowing you to do is more fresh air, more fresh air. If you have an HVAC system, we would always recommend that you try to put that into the return air side of your HVAC system, so then your HVAC system can then condition the air. So, you know, in the dead of winter, it's still going to be cool. And if that blows on you, you might feel a chill. So the ideal situation is to get that tied to the return side of the system, so the system can heat and cool the air as necessary.
Great, thank you both, and thanks everyone for your questions. We're out of time, unfortunately. I'm just going to pass it to Teresa to close us out. So thank you.
Thank you all. I think those were great questions. And I'd like to thank Peter and Karen and Mike as panelists today. Unfortunately, we're out of time, but please feel free to reach out to us. There's our email address here at eeost@children'sinvestmentfundma.org. If you have any additional questions, we're happy to talk through your space issues or refer you to Peter or Mike or Karen if we can't answer one of your questions. Again, we will share the recording of this webinar with all of you via email, as well as the training evaluation. And it would be really helpful if you could all fill that out and send that back to us. We would really appreciate that. But thank you all again, and have a wonderful afternoon. Thanks.